I'm Dr. Douglas Street. I am a general practitioner from Montego Bay, Jamaica. Now, today I want to speak about same sex attraction and transgenderism. Now, this is an issue that is very, very sensitive because it goes to persons' rights to choose their lifestyle and even their own identity. Now, it is not my intention, of course, to cause any discomfort or to let anybody feel any less of a person. But I just want to examine the scientific evidence linked to these two phenomena. Of course, they are linked. Um, if you are a person of male sex and but you identify as a female, then more than likely, in terms of getting into a relationship, you will want to get into a relationship with a person who is of the male sex. Of course, that's not always the case, but just to say that there is a link between the two. Now, persons with same sex attraction and transgender ideation, um, they often say that they were born that way. Now, is that true, or is it not true? Now, I want to look at a couple of studies which actually can speak to these two phenomena. Now, recently, a study came out which actually showed that there are certain genetic factors that are linked to same-sex attraction. And there's another study which actually showed that there's distinct differences between the intestinal microbiome, the intestinal microbiota, which is the composition of the bacteria in the intestines, in persons who are of heterosexual inclination and those who have same-sex attraction. So there have been some biological factors shown, but you may wonder, how is that really? Now, they have found also that there are increased there's an increased chance of having things like anxiety, depression, suicidal ideation in persons who have same-sex attraction and transgenderism. Interestingly, persons with these conditions, anxiety disorder, depression, and so on, they have also been shown to have differences in their intestinal bacteria. So, what is the link really? Persons who have anxiety and the depression, they have differences in their perception about themselves, about their experiences, and there's also a link between anorexia nervosa and and imbalance in the intestinal bacteria. So you can see that there are differences in their perceptions about themselves, about their experiences, about other persons, about their environment, that may be linked to a change in the balance in the change in the composition of the intestinal bacteria. So how can that be linked to transgenderism and same-sex attraction? In these conditions, there are differences in their perception about themselves. As I mentioned before, a person who is male sex might see themselves as female. So, is it that there's some influence by the imbalance of intestinal bacteria, which brings about this particular perception? Who knows? Now, let us take it a little bit further. You do have persons who have this inclination, these inclinations, and they are quite comfortable with it. But there are others who are not. They may be in the church. They might be in a family setting where this is not acceptable, and they may not think it's acceptable, but they see themselves as being that way. Can anything be done about it? No, I've seen persons who have anxiety disorder, and they have very positive experiences from making changes that will change the composition of their intestinal bacteria and also adjust other factors that increase inflammation inside their body. Now, is it possible that if persons who have these ideations, can they experience a change by adjusting those as well? Who knows? Maybe something to explore. Thank you for watching my video. You can subscribe to my channel, and so that you can see upcoming videos. Take care.